Sir, my elbow is worrying me a lot.
What happened?
Since 10 days before I played cricket, but my elbow is just worrying me a bit due to my throws.
I mean, you are having pain?
Yeah,
Okay, where you are having pain?
left hand.
Left hand.
Yes, sir. Near this area, sir.
This area?
Yes, sir.
Okay. This side?
This side a little bit, sir. But this side worrying me a lot, sir.
Okay. What about this side?
This side no pain, sir.
Okay. Are you able to ride your bike?
No, sir. For the past 1 week, I can ride my bike, sir. But
Okay.
yesterday it was a bit.
Okay. From yesterday?
Yes, sir.
It is paining a lot.
Yes, sir.
Okay. You are not able to ride your bike even?
No, sir.
Okay. Are you able to carry your bag?
No, sir. I can't carry my bags. Just I'm using my right hand. Legs.
You are telling you are having this pain for the past 10 days.
Yes, sir.
But from yesterday only the pain has increased, you are saying. Then whether you found any swelling on your pain?
No, sir. At that time, no swelling, sir. But when my friends touched it, it was a bit.
Okay. Okay, I can understand. That means already for the past, before 10 days itself, you came to me. I know that it was a little bit of almost like inflammation, the inflammation of the wrist extensors. So it was almost a sign of tennis elbow. But it was subsided. But yesterday also you went to play. Again, I think there must be a repetitive strain in your wrist extensors.
Okay, sir.
The wrist extensors must be the wrist extensor group of muscle must be maybe what do you say will be going for continuous wear and tear because of repetitive strain over the head of the radius, right? Yes. So it will be continuously rubbing that head of the radius, so it will be going for inflammation. So maybe because of that it will be having pain. I think it's almost like tennis elbow only. So if we subside that inflammation, whether you kept ice packs or something?
No, sir. I didn't kept an ice packs.
Okay, ice is good for this, but anyway, I'll do one thing. The radial head will be here, inside. So this is what the radial head. When I'm palpating itself, your face is going for frowning a little bit. So I think there is little bit pain over there. That means the wrist extensor that is actually rubbing over the radial head. This is what radial head means. The wrist extensor will be rubbing over that continuously. That is what repetitive strain injury of the wrist extensors over radial head. So this is what we call it as tennis elbow, typical tennis elbow. So already you have this, but now the pain, I think the inflammation is a little bit worse, I think. So what I'm planning is, I'm going to release the trigger in this wrist extensor group of muscle, one. Second thing, I'm going to reposition the radial head. Okay, the radial head will be little bit posterior and inferior. So I am going to realign the radial head into its original position, so that when the ulna and radius will be in a smarter position, the wrist extensor will not rub over the radial head that much. So I am going to realign that. So these two things I am going to do. So first my plan is little bit trigger release, afterwards followed by high velocity thrust application for elbow. So that's what my plan. Okay, you will cooperate with me. It won't be that much painful. It will be soft only. But anyway, if there is any pain, you just inform me. Okay. Yes. Okay. So there are many ways to. This is the wrist extensor that you are having the pain. Okay. So this is the area, especially the radial nerve, the region of the radial nerve that has gone for a little bit swelling. I can feel it over there. Okay. So what I'm going to do is, there are many ways to release this trigger point. Okay. In this way, this is so simple. Relax. This is so simple technique. What I'm going to do is, I'm going to palpate this wrist extensor bulk of group. I'm going to use the squeezing technique. If there is so painful, you just tell me. Okay. Squeezing technique is like almost like squeezing the paste from your morning routine, from the paste tube of the paste. You will be squeezing the paste, right? Like that. I am going to squeeze it from the knot. I am going to find out the knot, muscle knot, and I am going to squeeze it like this. It's not beyond the tolerable pain limit. I will continue for 5 minutes. Within few minutes, you will feel that the pain is reducing. Now we go for short stretch. Right. What I'm going to do is the grade 5 manipulation for this. Okay. Stand straight. Don't be afraid. Be relaxed. Be in erect, relaxed position. Relax, but it should be so straight. Okay. If you want, you can increase the space between the legs so that you will be comfort. Okay. Be relaxed. If you have a deep breath, okay, relax. Completely relax. You should not, when I'm going, actually I'm going to lift your hand like this. You should not round your shoulder like this. You just be in the position. Okay. Just I'm going to fix the elbow in its position. Pass. Relax. Relax, relax, relax. Okay. That's all. Right? Make few movements like this. Okay. Leave it. Okay. Sit down, sit down. How do you feel now?
Much better, sir.
Much better.
Yes, sir.
Do some movements like this. Have grip movements like this. Right? The only exercise what I'm asking you to do is the stretching of wrist extensor. You go and do it in your home.
Okay.
Only the stretch, no other exercise. If you want, you can keep ice. Okay, frequently, like 4 or 5 times a day, and stretching, small, at least 4 or 5 times a day. You do this. I think, I hope tomorrow your pain will not be there. I hope so. Okay, thank you.